Dear viewers, I hope you are all fine. This ultrasound video shows a case of secondary hematometra following the atresia of the lower reproductive tract involving the cervix and vagina due to inflammation. You can see the uterus, and uterus is distended due to the presence of a large amount of thick fluid. The whole of the uterine cavity is filled with thick fluid, and cervix there is stenosis or atresia of the lower reproductive tract, the uterus, cervix, and vagina. The uterus is distended, but the cervix and vagina are stenosed. The patient is married, having 3 children, aged about 40 years, and this patient has a history of recent abortion by D&C by a female health worker about 1.5 months ago, and since then she has developed severe pelvic pain. Hematometra develops when the uterus becomes distended with blood, as in this case, secondary to obstruction or atresia of the lower reproductive tract, cervix or vagina, which would otherwise provide an outflow for menstrual blood. You can see due to the inflammation and atresia of the cervix and vagina, the menstrual blood has been collected in the uterine cavity. Now, hydrometra is another term used for the abnormal fluid collection in the endometrial cavity. Common causes include obstruction of the cervix due to infection, inflammation, or malignancies. There are few cases reports of hydrometra in cervical carcinoma or endometrial carcinoma. A grossly distended uterine cavity may appear cystic. As in this case, you can see the collection of fluid in the whole length of the uterine cavity. Cervical stenosis may be congenital, but not in this case. Congenital or acquired, as in this case, for example, caused by menopause, cervical surgery, endometrial ablation, cervical or uterine cancer, or radiation therapy. Cervical stenosis is usually asymptomatic, but this is a gross dilatation of the uterine cavity due to the accumulation of the menstrual blood in the uterine cavity, and the patient is experiencing severe pelvic pains. Bleeding during miscarriage can appear brown and resemble coffee grounds, or it can be pink to bright red. It can alternate between light and heavy, or even stop temporarily before starting up again. If you miscarry before you are 8 weeks pregnant, it might look the same as heavy period. Now you can see the transverse view of the uterus. Now this patient has dilatation and curettage after abortion. This procedure, dilatation and curettage, is a procedure to remove tissue from inside the uterus. The doctors perform dilatation and curettage to diagnose and treat certain uterine conditions such as heavy bleeding or to clear the uterine lining after a miscarriage or abortion. Now, the black blood may appear at the beginning or end of person's periods. The color is typically a sign of old blood or blood that had taken longer to leave the uterus and has had time to oxidize, first turning brown or dark red and then eventually becoming black. A closed cervix can also cause infertility because some sperms cannot travel into the uterus to fertilize an egg. If you have already gone through menopause, you might not have any symptoms. Now you can see the affected portion, and the affected portion measures about 6.1 centimeter into 6.0 centimeter. The diagnosis of acute abdomen is one of the most daunting tasks in medicine. Acute abdominal pain is the reason for 5 to 10% of all emergency department visits. Hematometra is a rare cause of acute abdomen. Hematometra typically presents as cystic cramping pain in the midline of the pelvis or lower abdomen. Patients may also report urinary frequency and urinary retention. Now, this hematometra is a pathological condition, and it is a pathological collection of blood in the uterus. It is a rare condition that is most commonly associated with congenital anomalies or prior surgical procedures, causing an obstruction of the genitourinary outflow tract. You can find some important information in the description of this video. Thanks for watching. Please subscribe my channel. If you do like this video, please click the like button. Thanks.